I would have picked, I want to recommend a ride to you from Cedar Point. Can you hear me okay?
Yeah, I can. You weren't on my list for some reason. I am so sorry for skipping.
That's okay. No worries. I want to recommend a ride from Cedar Point for you. It's swings, and the swings go all the way up in the air, maybe 10 stories, and then they swing out over Lake Erie, and then so you go up, you go down, you swing around, which really prepared me for my career with NOSORH as a CEO and my work in the State Office of Rural Health. So I love that ride. It's neither a roller coaster nor water, but has elements of both. So thanks, Matt. Great kickoff. So the NOSORH update today is combined in the interest of efficiency of your time with the FORHP update. And we have a pretty simple agenda to kick off the regional meeting. And that is just, we're going to give you a quick update on all things NOSORH. We'll conduct a official regional rep election. We'll talk a little bit about the NOSORH strategy. And the big thing is that we wanted to build on, have a few town hall questions, and then we'll turn things over to FORHP for a couple of questions and also for their update. So thanks to everybody who helped. Yes?
You're in presenter view.
Natalie's running the slides for us, so thank you, Natalie. I was just about to say her name. Yeah.
Sorry. I think Chris, what's the trick on with the dual screens to do that?
You see display settings there in the top middle. There's a drop.
Oh.
Display settings, and there's a little caret below it.
Caret?
In PowerPoint.
Oh. Shoot.
Yeah, next one over.
This one. No.
The display settings one with the drop down, and you can switch screens.
I don't see the display settings, sorry.
It says show taskbar, display settings, and then end slideshow.
Show taskbar.
It's a terrible thing to do to your president-elect. Thank you, Natalie, for that. Honestly, if we'll see if we can fix that, but
there it is. There it is.
There you go.
I can do things. All right.
Thank you, Natalie.
Sorry about that.
No problem. I did want to give a shout out to Natalie Claiborne, who's the NOSORH president-elect from the state of Montana. I'll be turning things over to her in just a minute, but also always want to start every meeting thanking those of you who serve on the NOSORH Board of Directors and whose staff committees for us. John and Karen serve on our executive committee. Kirby and Heather are your regional representatives. Lisa has been a long stalwart for the educational strategy of the organization and chairing that committee. Lisa Davis as well chairs our policy committee and serves as a policy ex officio and a voice of reason in all things policy. And Kathleen McGillicott co-chairs the award committee to recognize the good work of state offices of rural health. So thanks to all of you. Next slide, please, Natalie. We just want to do a quick update on what's coming up. Certainly, I hope that you know that we've been working hard to help certified rural health clinics, both with their reporting for their first round of funding from the federal government last year, and we're continuing that work on supporting that work. Most recently, we've been engaged in helping RHCs like you have, I hope, to apply for vaccine confidence grant applications. We understand there are about close to 450, I think was the last number I heard, on RHCs who submitted applications with less than 36 hours left to submit those. We've been very well supported by the Colorado office, South Carolina office, and the Michigan state offices of Rural Health Champions. Tammy leads that effort as our technical assistance director, and Lynette Dixon is our SOAR champion as well for that work. So that's gone swimmingly. In a short order of time, we are able to get almost 100% of rural health clinic tax ID payer organizations to submit their report or renege them 5 times. So we're real proud of that optic, and that work will be continuing. We hope you know that National Rural Health Day is coming up again in November, and we're planning and launching all kinds of things for you. I think just maybe an hour ago, the Community Stars application and launch went into your email box. So we're hoping to have a story for every state. In a perfect world, it reflects the good work of your state Office of Rural Health, and we hope that you'll join us in that. Also, we hope that you'll look at the Power of Rural website. It's really been refreshed with moving video and lots of options, and focusing on celebrating the power of rural, about resiliency and response, and you know, real reality check of what it's taken to be part of rural health and improving rural health. So hope that you'll take a look at that. We will have a pre-meeting focused on helping reaching the underserved during the national pandemic. All are invited to pre-meetings, just as they were to yours. That's on June the 29th at 3 p.m. And then there'll be a roundup of all the resources, the proficiencies, the webinars, the other toolkits that are coming out to you. So kind of a one-stop shop about what's new coming up on July the 15th at 3:30. So keep your eye out for all of that. Also, I don't have the due date for you, but during this, we had a meeting with Kathleen and Margaret Brockman, her award committee co-chair. Remember that we collect and try to honor the work of the state offices of rural health, and those award nominations will be coming out soon. So you'll be hearing more about that. Next slide. So just a quick update on policy. Two things. We have two policy priorities this year. One is to increase appropriation for state offices of rural health from your current line of $12.5 million to $15 million. We're very proud that it increased last year. Needs to continue to grow to help you do all this capacity building work. Right now, the appropriations process is heating up. I think that markup will be done. I think the date was July the 13th. You'll be getting an email from Matt with the sample email to send to your legislators if you have people on the Appropriations Committee. We know that you have to do that work separate from your federal funding. We do this work separate from our federal funding. We hope that you have a state partner, or that you're able to educate your members about the work that State Office of Rural Health funds do. And then secondly, we're working on flex reauthorization, and we're working closely with the National Rural Health Association as they work to include a growth and the technical assistance capacity of state offices of rural health, focused on transformation and taking advantage of telehealth, and really positioning state flex programs and funding for non-flex programs to be able to do the same kind of work. And certainly also to take advantage of the opportunity on rural emergency hospitals. So as that's evolving, you'll be hearing more from us as well. We are trying to target our emails to state offices of rural health who may have key contacts and key legislators to educate in this way, but there'll be general information in the Roots newsletter and all of that. I think that's the next slide is, that's it for the updates, but I'm happy to hear any questions, and I'll watch the chat for those. So if there's anything that you want to know more about, feel free to ask me. I'm going to turn things over to Natalie here in just a minute. But one important business item is that the NOSORH board is unusual in that it is diversely composed and constructed. One of the things that we stay true to over the years, since our founding folks put together our bylaws, is that we do have representation from every region. And we call on two people from every region to step up as leaders and do all those things that are on that list on the side. And I wanted to thank Kirby Lacey for the last term that she served is expiring and will expire December 31st. And when Michelle Mills did a call for nominations for the regional rep, Kirby agreed to be considered again. She was our only nominee. So I would ask that you all give an aye if you support support the nomination and the second that we received. So maybe just take yourself off or mute for a minute, show Kirby a little love and say yay or nay if you to respond to a call for a vote.
Well,
Yay for Kirby.
Yay!
Yay!
Yay for Kirby.
Thank you, Kirby. I should probably
Thank you.
get slapped around by Karen Madden, who serves as our parliamentarian, and I thank you for that. I love this photo of the two of them together, and this was back when we recognized Kirby for her role as an emerging leader, which she has been true to and really made a commitment to serve all of you. So that's it for me for a quick update. I'll check back on the chat to see if there are slides, and then I'll turn things over to Natalie, who's coming up to serve in her presidential year, and she has been plugging away at supporting state offices and work for NOSORH. I don't even know how many years, Natalie, but I love to see your leadership take place and come in, and thank you for joining the Region A meeting.
Thanks. I'm so happy to be here. It's fun to get to see other regional meetings and how you guys interface and interact compared to our region. So it's really just neat to see how everyone comes together around this. I always value the regional meetings so much, and I appreciate the opportunity to get to share with you guys. So as a board, we are working on our strategic plan. So the mission of NOSORH is to support our State Office of Rural Health and also our rural stakeholders. So we're doing this through leadership development, advocacy, education, and am I missing something? Partnerships, right? So we as a group come together and create a strategic plan. So the plan that you see in front of you, I hope is not new. You should have seen it a couple of times over. And I'm not quite as elegant as Terrell is about talking about it because she has it on the back, in the back of her mind. But we really are working to create strategies or a plan that is around those 4 key areas of cultivating, growing, building, and advocating. And we do that through communication, education, collaboration, and innovation. So with that being said, we are working to continue this plan and refresh it and make sure that it's addressing the more current needs that are happening, ones that maybe we didn't realize were forthcoming in 2019. But we're really this year focusing on adding diversity and inclusion efforts to really shape the programs that we do, the language that we use, the communication that we have with external partners, looking at broadband and how that affects our communities, or we know that it affects, but how do we talk about that with our partners? Growing engagement with our emergency response to make sure that we are there to support that system, but also the rural public health through this emergency pandemic. We've noticed or seen how impactful that can be and just what this pandemic has done in that landscape. And then finally, to focus strategically to reach out to specific stakeholders that maybe we have engaged with in the past or may need to, could strengthen further. So with those thoughts in mind, today we were hoping to hold a mini town hall with you as a region to discuss some of those issues and help us to gather information as we're really revisiting our strategic plan and kind of operationalizing that and supporting the staff in the activities that they're choosing to do to address that mission and those goals. So we heard from state offices that we as membership would love to have more opportunities to share and to have that engagement. So we decided to hold multiple town halls. We did one earlier, gosh, I can't remember how long ago that was, but not too long ago. We just had an update on everything that happened since at the annual meeting. We didn't have necessarily that opportunity to do that feedback and to share the great work that NOSORH's been doing. So with that too, we'd like to hear back from you as a region or representatives of your state so that we're making sure that we're addressing your needs as a state office and how we can help you in your work. So we're obviously always keeping in mind that strategy and that strategic plan as we go forward. And as I mentioned, this information that we are collecting around these different various topics are all going to help NOSORH to plan the activities that they're going to be engaging in the next year. So the first town hall question we have is related to emergency response. And our question for you is, how is your state office partnering with emergency preparedness and disaster response? What stakeholders are you engaging with, and how has this pandemic affected your relationships with those folks in your states?
So yeah, if you want to raise your virtual hand, we can call on you, or if you want to put a comment into the chat box. But
Has anyone been engaged?
Elisa?
So not exactly, but I would be interested to hear. So our emergency response unit used to be in a different part of Health and Human Services. And during the pandemic, they were moved not only into public health, but inside my bureau. So we haven't really met anybody per se in person yet, but so my expectation is that there will be opportunities to engage with them. And the guy who's running it is brand new and is from California and moved here during the pandemic. So I'm interested to hear if other people have just as sort of thoughts for the future as far as like looking for opportunities in that relationship. The only thing that's happening now is they are responding to, I think it's the CDC crisis workforce grant that's out. And they're responding to that, and they've been gathering a lot of information from people, and I've just been sort of looking at it and just making sure that they understand rural and that I'm their go-to for medically underserved communities, that thing that's not a thing, and that sort of thing, just to let them know that that's what we're here for. But that's really the only kind of project that's happening right now.
Thank you.
Jill?
All right, is it working?
Yes.
Okay, good. Hi, so Natalie, I actually come from emergency preparedness, which is housed in the Department of Health. That was actually my first role there. So we've always had, the office has always had kind of a special place in my heart for emergency preparedness folks. And we are, I actually was going through the training to be certified in disaster response for my particular area of the state. And so we have a building emergency safety team that's run out of EMS that works with the municipalities. And then we have representatives at the Department of Health. So we're doing all of that training now in-house, which has been great. And hopefully we'll pick that up soon. But we've always really been, I've always really, like I said, kept in touch with the people in emergency preparedness. So I'm usually one of the first ones called up in the event of a disaster. But as our office, the one thing we're focusing now, I would say, is on the aftermath maybe of COVID, as far as mental health first aid training and things like that with our rural stakeholders.
Great.
I don't know if you have anything to add, Margaret.
I mean, I think the only thing I would add is that a lot of emergency preparedness in Rhode Island is around climate change. And so Jill, so that's a separate program, but there's lots of coordination, and Jill served on the climate change panel. And we participated in local meetings with the infrastructure bank, which was coming up with a strategic plan for the state for climate change. And so I would say, yeah, that we're generally involved with emergency preparedness.
Great.
Thanks, Margaret. I totally forgot. It seems like a lifetime ago that I was working on that.
Exactly.
Lisa Davis?
Sorry, I wasn't ready to be called on. So I want to say, sort of on the other end of the spectrum, because we're not within state government, we were not really engaged in what our state Department of Emergency Preparedness or Emergency Management was doing, even though our health department essentially moved all of the COVID response over to the Pennsylvania Emergency Management Group. But we do talk regularly with our Emergency Health Services Council. And one of the things that we talked about with them a lot was the challenge that the rural EMS units were having financially because of the significant decrease in calls that equated into real reductions in reimbursement. Those EMS units were and are really struggling. So that's sort of been our interaction with emergency response.
Thank you.
Omola?
Hi, sorry, I need to change that to Lola. It's so much easier. So our actual EMS, our Office of EMS, has been pretty intricate in creating a lot of the mega sites. And then also, so for like our vaccination efforts, and then helping us now do kind of more pop-up sites with the mega sites, since we don't really need those as much. So we've been kind of all coordinating as far as just making sure that we're addressing different vulnerable populations and determining kind of where the needs are. And yeah, really kind of all hands on deck when it came to COVID. Everybody, I started about 8 months ago, and everybody had like a day job and then a COVID job. So it's been half the time, you know, people's COVID jobs a little bit more than their day jobs these days. But yeah, there's been a lot of coordination across, you know, the board, just because everybody's kind of had to take a different piece of this lovely beast that we're in at the moment.
Thank you.
Thanks. Sarah, sites?
But here in Maryland, I think because of our decentralized nature, we have a local health department in every jurisdiction. So there's not much that we get called on to respond to for emergency preparedness, because a lot of that information gets distributed down to local health departments where it can be tailored to the needs of those populations. However, where we were called on was our opinion and point of view on a variety of task forces. And I'm definitely curious to see how many of those continue as we really look down the line of health equity and how it plays out in emergency preparedness. So potentially we'll have a future relationship. And actually, interestingly, just had an outreach from our Maryland Institute for Emergency Management Systems this week on a grant that they're going after that very generally mentioned rural. Really just for them to get the definition of what rural means in Maryland and federally. So we'll see where that partnership gets to go in the future.
That's great.
John?
Yeah, in Vermont, we've had kind of a limited experience, but during the pandemic, we have been participating and listening in on the every day and then a weekly healthcare emergency preparedness coalition calls and getting their status updates and finding out what their issues are. We used to have a closer tie to hospital preparedness with a shared position, but in the last 7 or 8 years, we've not had that connection. Our EMS director, became the division chief and also the Health Operations Center commander. So he got some new staff, and so we're trying to make some additional connections with our rural hospitals and the EMS groups across the state.
Thanks, John. Natalie, I don't see anything else.
Okay. Just one follow-up. Oh, I'm sorry. Was there someone?
This is Nicole from Maine.
Sure, go ahead.
So actually we sit within our emergency preparedness. So they're like right next to us. So we are their go-to persons for anything rural and assistance that they may have needed. Especially during the time of COVID. Like John, we have daily calls 7 days a week to get them updated, and also through our reassignments, we have worked closely with them and our staff, addressing some of the barriers of accessing to PPE, or working with them to work with our rural facilities if they have not been able to make contact in getting vaccines out to them or reporting or anything like that. That's all.
Great, thank you. Any opportunities that you guys see? I mean, I heard one person say, you know, it's yes, the pandemic, but it's also the post-pandemic response. Any other opportunities that you see or potential areas to work or explore? Okay. Well, I'm going to pass it on to the next person, Heather, for the next question. Heather, take it away.
Great, thank you, Natalie. It's nice to meet you virtually. So everyone, I get to talk about partnerships with rural stakeholders. So my question to everyone is, what kind of activities are you doing with new partners?
Aletha?
Me again, I'm the warm-up act. So I might be stealing thunder from my state sharing about the CDC grant, but we have been working with transportation, community-based transportation, not DOT, not Department of Transportation. And it really started, it started actually at the CDC Rural Hootenanny. And I met a woman there and she gave me her card and she was like, if you need to think about transportation, talk to me. So I've been thinking about transportation for my entire rural career, but like, who's got time? So right before the pandemic started, we decided to see, Alia Hayes, my rural health manager, and I decided to see if we could do something or at least learn. And we got started with these folks and the pandemic happened, but we've mostly been able to participate. And what happened is then when the CDC equity grant came out, I was ready to propose something and leverage some new relationships. And they are so awesome and they are so excited and they totally speak our language and they understand community and engagement. And they really want to talk about social determinants. Like they're just so much in our world and I want to be in their world. And so we're working together and we've already, even before actually getting the contract together, we've already leveraged and they've been rearranging their money to support all of the regions, including the ones that aren't rural. So I'll be doing that for the next 2 years on top of my regular job, but I'm really excited about it. And I do think that there's a tremendous amount of potential for us to meet, you know, beyond just accessing healthcare needs through transportation, but all of the things that make you a whole well person and isolation and all age groups and workforce, you know, getting the people that we need to work at the hospitals and other healthcare settings to their jobs and back and forth and really sort of integrating and thinking about transportation. And I love the community transportation piece over just sort of thinking about public transportation infrastructure, because I think it's so much like how we think about rural anyway, right? Where there are some guiding principles, but each community is going to have a unique approach for meeting their needs. And we know rural people love to help. So there are a lot of volunteer driver programs and a lot of ways that I think that we can learn from each other. So I'm pretty excited about that new partnership. I mean, I got closer now to the vaccine people and all, you know, internally, but as far as, you know, moving forward, I feel like the transportation people they're my new best friends.
All right, Lisa Davis, are you ready?
Yes, I am ready. So 2 new partnerships that we have worked on, and actually before I talk about that, Elisa, I'd love at some point to talk to you about your transportation work because that is such a major issue, you know, here as it is everywhere. And we have not had much luck being able to move the needle on that. But the 2 new partnerships that we have right now, I had given a presentation with another colleague in the state and a faculty member at the Penn State College of Medicine, who's also a hospitalist at Hershey Medical Center, was in touch with me, and she is an obstetrician and gynecologist, and she is very focused on rural maternity health. So we are working rather slowly, but trying to begin to develop a statewide network of those who are focused on rural maternity health issues and health disparities. So that is slowly moving along, and it's been wonderful. And Oluchi, our fantastic student intern, she's also in the Schweiers Honors College here at Penn State, and her thesis is going to focus on maternal disparities. So she is developing a brief for us and doing some other work. So that's been great. Another partnership that we started this year was bringing together all of the R-Corps grantees in the state once a month to share information among themselves, bring in external speakers and so on, because they really wanted to talk to each other and really did not know how to do that. So our office has been coordinating that, and that's been a real great benefit, I hope to them, but certainly to us.
Anyone else?
This is Nicole. So some of the new partnerships that we've developed over this past year is working with the Safety Net Dental Clinics, as I shared yesterday, with networking and development with them. Also, the other one is probably kind of unique to Maine is that we've, through the pandemic, have started working with some of the island communities and outreach around, mostly for COVID, but technical assistance, education, and also bring in attention that to our leadership that island communities do have people living on them in the winter, and that even though they may have a smaller population, they need access to healthcare and vaccines and things like that. They may not always have the transportation to get off the island.
Thank you, Nicole. Anyone else? Okay, well, I can share. Go ahead.
I see one more. Lola? You there? Lola? I saw you had your hand raised. Maybe not.
I'm sorry, Matt. Yeah, Lola should be here, but I can speak of behalf of our office here in New Jersey. Can you hear me okay?
Yes.
Okay, so again, Marisol Maya from Rural Health here in New Jersey. We just, I'm actually new in this office. I've been with this office 3.5 weeks ago. I mean, I started 3.5 weeks ago. So I'm still learning, and I'm sure I'll be learning for a while. But I just, I'm actually put the video here. So we actually reached out to a movement here in New Jersey called Cosecha, means harvest. And this movement is actually a nationwide movement, but they have that, each state has their own group. And so we reached out to them because we are interested in vaccinating these. This community is a big community, and it's all for undocumented individuals that came from everywhere. So we are excited that we'll be partnering with this organization to offer vaccines and some of our services. We are going to actually provide resources that are offered from the health qualified, is that called, I think it's called the HCQ Healthcare Qualified
Health Center?
Yes. I'm sorry, I'm still learning all those acronyms.
No worries. There's a lot of acronyms.
Yeah, so we are excited to
that will be providing all these resources to this movement here in New Jersey. I'll be getting together with, I believe, 20 coordinators because these coordinators, you know, they prefer speaking their own language. So most likely this meeting is going to be in Spanish because that's what they prefer. So it's going to be you know, nice partnership, and you know, the fact that we'll be able to help this movement with you know, many of their needs is kind of exciting.
Hi, sorry, I finally got myself off of mute. Sorry. So yeah, along with what Maricel was mentioning with Cosecha, another partner that I wanted to mention was the cooperative extension. So for us, it's Rutgers. And so in the same line of working with, you know, the farms and trying to kind of do a little bit more outreach, since especially we have a lot of migrants that are coming up from southern states to work on our blueberry farms. And so it's been a really helpful partnership with them, and because they've been reaching out to a lot of the farms, you know, they've been letting us know if there's certain farms that have to get, you know, that would like to get vaccinated. And so there's been a really wonderful kind of partnership, and we're, you know, in communication pretty much every week or so. And so that's been a really interesting new one that I would love to kind of capitalize on going forward, especially when it comes to kind of food insecurity and those types of issues. And so I've been really excited to kind of learn the different ways in which we can partner. That's all, sorry.
That's all right. Thank you, Lola. So I guess the next question is to everyone is, what rural stakeholders would you like NOSORH to reach out to? I know in Virginia, one of the partnerships that we have, and you've probably heard me talk about it before, is we work with a United Way that has a very large footprint in Southwest Virginia. So I'm wondering if at some point we would engage NOSORH to reach National United Way and learn about them to see how they intersect with our rural and underserved communities. What other ideas do folks have?
Heather, this is Margaret. I'm trying to figure out how to raise my hand. Can you hear me?
I can, Margaret, go ahead.
So yeah, I think United Way is a good idea. Actually, our local United Way reached out to me around an urban issue, but actually it also is a rural issue. They were trying to set up or work with communities, low-income communities, to establish free or low-cost Wi-Fi networks to ensure that everyone had access to the internet. And I would really like NOSORH to be reaching out. I mean, that you already have reached out to broadband partners, but in the course of trying to provide technical assistance for the United Way in Providence, I sort of came across some new things and new groups and entities, but it's something that I would really like. I think it's a really high stakes issue now as the healthcare system is transforming and becoming more dependent on remote access. So I would like to see NOSORH do more about broadband, but also community-based efforts. I was on a call, I was listening to a webinar yesterday around the new National Academy report on implementing high quality primary care. And the topic yesterday was digital health. And they spent the whole hour and 25 minutes talking about physicians, EHRs, vendors, health systems, and all the digital needs of those groups. And I put in the chat, would somebody on the panel please address digital equity? It's in the report that you released, but the conversation here has all been about physicians, vendors, you know, health systems. And fortunately, the moderator did pose the question to the panel in the 5 minutes that were left for audience questions. And, you know, there was kind of crickets at first. And then there was an answer. And finally, Andrew Gettner from Dartmouth Hitchcock brought up rural electrification and that model. So, you know, this is something I've talked about before on some of the calls, but there are models about community-based utilities. And I just think that that's something I'd like to learn more about, and possibly through NOSORH. That's it.
Thank you, Margaret.
Lisa? David?
Thanks. I just wanted to say that under the leadership of NOSORH, there's a group that's come together being led by Ernie Scott from Kentucky that is looking at stakeholder involvement and developing a strategy that will be proposed to, actually Terrell can speak more intelligently about this, but that will be, I think, proposed to the NOSORH board overall and then shared with the members on stakeholders. And so some of the groups that you already have talked about are groups that we have thought about as well. So that's fantastic. It makes me feel good that we are in line with what the membership is thinking. And another group that we are thinking about trying to reach out to in a concerted way are the philanthropic organizations, either across the country or getting technical assistance in reaching out to philanthropies in our individual states.
All right, Jill?
Okay, well, two things I think came out in this pandemic. Certainly working with the fire departments, fire EMS in rural areas, and churches have been like the most trusted resource that we're finding, that people can encourage people to do things. People like the local churches and the local fire departments, and they trust them. And then I will just say that I will echo what John said. I was on a call with the FCC, and some of you may have been on it with the rural stakeholders about the new broadband money that's out there. And so that would definitely be a partner that I would encourage.
There were some others in the chat that we'll note. But I don't see any more raised hands, Heather.
Okay, thanks, Matt. I think that's it for my presentation. So I think the next person up is Kirby.
It is. Awesome. Thanks, Heather. So this is our last question for you all. I think just to give a little bit of context around some of this is that the board has been undertaking a kind of an inventory around what we should be doing in the diversity and inclusion and equity space. Corey Kaiser is leading up a health equity task force that is going to be kind of looking to fill gaps and needs that members have. And so today I wanted to get a little bit of feedback from folks on what resources you all might need to promote diversity and inclusion in your rural communities. And I think one of the things that I really think about around this, and I hope you all can maybe plug into a little bit, is that here in Massachusetts, we've been incredibly lucky, specifically in the bureau that we sit at the health department, to have had some really amazing resources around this for our own personal exploration in this space, as well as how that impacts our programs and our state as a whole. When we're thinking about things like structural racism or special populations that we're trying to reach. And, you know, I know that that probably doesn't exist in all of our states and in all places. And so how might NOSORH be able to promote this for you, or find tools or things for you that could be helpful? So what resources could you use? And I will shush my face now.
Kick us off, Elisa.
I figured why stop a streak. So I had been part of the equity group here before the pandemic, and then, everything with banana beans. So we have been part of the vaccine equity allocation team now, Alia and myself, with a rural focus, but have been then exposed to like all things equity in practice, which has been great. And so some of the things that were built into our CDC equity response were things that I think, could also be tools. So one of them is the ability to sort of have a tool that helps you decide if the project that you're proposing has taken an equity lens. So we're going to be requiring everybody to run everything for underneath that CDC grant as it goes out as a contract, but also just in general through that tool to make sure that we are meeting all of those. And then some of the things too is, just the recognition that you need to talk about and approach the collection and reporting of that data in a different way, and having those conversations and things like that as well. But then you also have to have whole people that's their job. And I know that's crazy because, we need that for everything, but this recognition that is a very distinct set of skills, and that person not only will be doing their role, but also sort of training other people about how to talk about and collect and analyze and report on data that has an equity lens in a way that's appropriate. And that person really needs to be keyed in nationally, because that's a conversation that's happening, right? All that stuff is being developed and retooled all the time. So I would say that, this framework thing, and just a reiteration that like, don't do equity work unless you can 100% devote to equity work, because if you're doing it right, it should be really involved, tremendous amount of resources, and take a long time to a certain extent, because otherwise you're not really taking apart your system and looking at things. And so I think that sometimes it can be worse if you say you're taking an equity lens and you don't actually make the appropriate investment, or just be really clear about the fact that you're only going to do one piece of it because that's what you can do. But I think that transparency is important as well, so that it doesn't just seem to be the flavor of the month, and the thing that people are into, but it's not real.
Great. Thanks, Elisa. Absolutely.
Kirby, I'd like to say something, and I too, like Margaret, I can't figure out how to do the raised hands. So I don't know if I'd be next or if someone else
You
raises
go
their
ahead. I think Lisa has her hand raised too, but I'm sure she'll let you go first. Because I know
Okay.
Lisa.
Thank you. I just wanted to say that having just come out of the committee, what do you call it, awards committee meeting with Margaret, and we were talking about adding, making sure we have a membership committee with enough members on it and all that. It came out that maybe the board needs to take a stand on diversity inclusion, make a statement and make sure they have a stand on this issue and a policy. And then, and then we need to, as an organization, as a board, and then as an organization, model diversity inclusion too. I was trying to make sure that that we had some diversity on the awards committee. After all, we're making decisions about other, in terms of the worthiness of other people's work. And I thought that we should have some diversity and, and the lenses that people are looking through. And, but the board, but we need to be modeling that behavior in our committee and the board and our committees, and really to make sure we take a stand on it. So that's my 2 cents.
Great. Thanks, Kathleen. Absolutely. And then Lisa, I see your hands raised. Sorry, Matt. I think I'm taking your job over.
All right, I'll
Do it. All good.
I hope this isn't going to be too provocative, but what I would really like to get training on is how to promote diversity, equity, and inclusion in rural communities. And I think that that's going to be something that we'll be focusing on when we get our CDC funding for the diversity grants. In Pennsylvania, we're pretty homogenous in most of our rural counties, and it's homogeneity across many different perspectives. So not including racial and ethnic diversity, but also culture, political opinions, and religion and so on. And I think it's going to be really challenging when we start actually working in communities about a topic that can be very charged, which of course is the COVID-19 pandemic and vaccinations and so on. And I think that fits in with this notion of diversity, equity, and inclusion, because I think that all falls under the same framework. So we could really use some training along those lines, especially when we bring on our new staff.
Great, thanks, Lisa. Agreed. Other thoughts from folks? If you don't raise your hand, you can just pop in. And I do want to just follow up a little bit in regards to the fact that there are two things that are kind of happening in the board right now. So one is around, Kathleen, your exact point around governance and how the organization has policies and is modeling this work. And I think to that point as well, and kind of tying into Elisa's point, is that the board is being really thoughtful about making sure that we're not just making a blanket statement and a policy because it is the flavor of the moment, that we are actually taking a deep look at what stakeholders we are working with and how those stakeholders are represented, and what ways as an organization we can impact pipelines. So although we may not be able to necessarily choose who state offices are hiring, we can absolutely think about how we are empowering folks to be able to acquire those positions. And one example I use a lot is myself as a state office person now. I was a community-based organization, and our state office of rural health, Kathleen, offered me a scholarship to attend the NOSORH Leadership Institute, which gave me a pathway into being able to apply for a job later on. And now I sit here in front of all of you. And so I think there are ways that we can think creatively as a board and an organization as a whole, and how we are allocating resources to make sure that people who live in rural and represent our rural populations, who look like our rural populations, who speak the languages of our rural populations, are part of the larger whole. So there's that piece of things. And then there's also the piece of what kind of things do we need as offices to tool into doing this work. So to your point, Lisa, the training to have those difficult conversations in communities. And that's going to look different in lots of different spaces and places. So I really encourage folks to kind of think about this. And if you come up with stuff after the fact, as your regional rep, you can talk to me anytime, and I'd be happy to bring these thoughts back to the board. This is an area I feel really passionate about in moving forward for the organization as well. So I'd love to noodle with you and to think about these things. But and if you see things out and about in your work and in your spaces that you're like, oh, that's great, maybe we could do something like this with NOSORH, make sure to tag into that too. And thinking just as a whole about the many special populations that our rural areas, touch on. And so any other thoughts around that?
Just one quick comment is we do have a dedicated activity task force on the board to help us wrap our heads around those two things that Kirby mentioned. And if you're interested in volunteering to be part of the task force that really is going to take this effort on and help us think about and adopt policies and activities that are true to true diversity, inclusion, and equity, we'd love to have you join. Corey Kaiser is the dedicated appointee to work on that. You can let me know, or you can email Corey directly. You see there's a link on the slide there for you too. Thanks for putting that in the chat, Matt. And with that,
all right,
we can turn things over to FORHP. We took a little bit more time than we actually intended to, but what great input we got. If you all don't know, NOSORH is funded, about 60% of our funds come from the Federal Office of Rural Health Policy. good thing about that is we have a true partnership with FORHP, and they are key to the success of NOSORH and to the resources that we have. And we've broken in a new project officer this year, Sarah, and she's been really supportive in a quick study and been really enthusiastic about this work together. So Sarah, we thank you for your contribution and turn things to you.
Thank you so much, Cheryl. Thanks for the introduction. That was very good discussion. If anyone has any other ideas, we are always happy to hear from you, even after this. So I'll start with our Federal Office of Rural Health Policy update. As I've met most of you, I am Sarah Diangui. I'm with the Hospital State Division. And I've only been here about 7 months, and I've really enjoyed working with you.
Next slide.
Next.
Or just let me know. Okay.
So one of the key roles SOAR play is helping to facilitate community knowledge about FORHP grant opportunities, and can also facilitate the expansion of SOAR networks and strengthen relationships with rural stakeholders in your states. We do this at FORHP, we do this by sharing notices of funding opportunity announcements through the SOAR listserv, which you can share with your stakeholders and partners in your rural communities. We also share the list of funded applicants within your state and make introduction of SOAR offices to new community partners to enhance collaboration and resource dissemination. Next slide. So we wanted to know, as we meet as Region A, what other things do you do in your state to connect with FORHP grantees in your communities? We would like to learn what has been successful in fostering those connections within your state.
Okay, if you want to raise your hand and I can call on you. Lisa Davis.
Well, I don't mean to jump over Elisa, but a couple of things that we do here in our state. Of course, whenever we know about who the grantees are through any of the FORHP grants, we reach out to them, congratulate them, offer to work with them. And sometimes we're already very knowledgeable about what it is that they're doing. The other is with these R-Corps grantees in the state. That's been very successful in terms of, I just happened to have a conversation with one who called me about something, and out of that grew bringing this group together. The other group that we work really closely with is the Mid-Atlantic Telehealth Resource Center. I serve on their board. I know Kathy Collison is a representative for Delaware. And we've been pulling together the matrix stakeholders, I guess they call them, here in Pennsylvania to talk about what's happening in our state regarding telehealth and policy and payment and so on. So those are just a couple of examples I can think of.
Thank you. Anyone else?
Lisa?
I guess your hand was faster than mine, Lisa. No, I was going to say, I love your R-Corps thing because I think that's so awesome, because we've definitely done that informally, but not intentionally. And they have found that it's been super helpful, just helping. If someone's been one longer than the other, they've sort of learned the ropes, which is great. You know, I always mentioning the SOAR in all the grant stuff is super helpful, because they'll, you know, new people who haven't heard of us will reach out. And once we create that relationship, they tend to keep us sort of engaged, which is wonderful. I have to give John Olson props. He connected with that. Yeah, look at that. He connected us with the Northern New England Translational Research Network. I think I got that right. And it was kind of daunting because they had us as a seminar, and like everybody before us was amazing and invented all kinds of medical stuff. But anyway, so John and Nicole and I represented Northern New England, and we talked about rural, and we shared some stories and really tried to talk to them about how to come to rural research with the right frame of mind. And that was a great opportunity and a great connection. And I've heard back from those folks myself multiple times since then asking about rural. So I think every opportunity we have to sort of inject ourselves into other places that we normally wouldn't be is great. And I'm going to skip ahead and give you a suggestion, Sarah. So the hardest thing for me, I feel like in the olden days, we used to get a specific list of awardees in our state, and then it was really easy, and I would sort of match them up with the letters of support or some of the other things and sort of be able to track who got what where and who to circle back with. And now we just get the standard press release, and it sounds stupid, but you have to go click and then scroll down to N, and maybe it's not N, it just skips right past. So it's been harder for me personally, to do that easy kind of looping back and seeing who got what where. And even just outside FORHP, it would be great to have I don't know, an easier way to just figure out what happened in New Hampshire, and just for us to keep up, because I do try and keep track of that, and I do keep copies of everything, and sometimes it's just hard to know what's been awarded and what hasn't to whom. So, and also, oh my God, their abstracts. I would love to get their one-page abstracts easily. That used to be a thing too. We could click on it and it would show the award, and then we would click and it would take us right to their abstract. And then that was good refresher too, because grant season, you write a lot of letters of support and all those projects start to blend. So that would be super helpful as well.
Thank you.
I won't have to raise my hand again.
Thank you so much. Anyone else with what has been successful fostering connections in your state? Well, the next question, what suggestions should FORHP consider to assist you in making connections? We have our first suggestion from Elisa. I don't see the chat, but if there's any other questions.
I was going to say, Nicole, a lot of dittos from what Elisa mentioned.
I'm curious, this is Terrell. I apologize for not raising my hand. Elisa, what is different now than what you used to get? Maybe you could quantify that a little bit.
Sure. So we used to get, I think it wasn't just me, we used to get to the state office a notice that the award had been made and a state specific list of who got it, or at least a direct push to us that people had been awarded. And then you would click on next to the organization, or there was some sort of hot link thing that you would click on, and it took you directly to their project abstract. So I could look, the years when you've got network planning, development, and outreach out, they all start to blend together. So right. I could go and it would be a push to me of who in New Hampshire got awarded. Like I literally used to get emails that said, the network planning grants are out, and one New Hampshire applicant was selected, and then it told me who it was, and then I could hot click to the project, hot click anyway, hot link, which my husband says is an outdated term, but whatever, to that project abstract and directly look at it. And then I would save it back into the folder where I did their letter of support or whatever. And then I would put like a little tickle for myself to email them. And I think it's really nice to be able to reach out to them and say congratulations and things like that. And sometimes it's just hard without getting that push to you to keep up with when all the awards came out to kind of circle back with people. That's all.
I think you could probably get some of that. I mean, that could probably be pulled together from I don't know what the timing is about when that stuff hits the HRSA data warehouse, but it's probably there. But it's something to think about.
Carol, this is Kirby, and it is all there. It's just obnoxious to navigate, I have to say.
Okay. Thank you.
So it is just nice to kind of have it. It's like the old adage of marketing. If you have to click 6 times, it's it's obnoxious. So we get this email that then you have to click to the press release, and then in the press release you have to click to the list of awardees, but that's not in the data warehouse. So then you have to look at what the awardees are and go to the data warehouse, and then half the abstracts are in PDF, half of them are in Word. They all download different. It's it's a mess every single time, and I get so frustrated. So I hear you.
Well, I've raised my hand, but I'll just talk. One of the things too, and Sarah, this goes back to a really long time ago, actually back to the last century, when the federal office was first started, and I first started with the office. You know, it was small enough that we knew everybody. And it was pretty easy to put the list together of who to talk to and where to go to get information. And now, for very good reasons, it's wonderful. The federal office is much, much larger, and with many new folks coming in, there's really no way anymore to know who to talk to about a particular issue unless it's someone who you know you're supposed to talk to. So I realize that FORHP may not want to put that out on a website or whatever, but it would be really helpful for the state offices to have that. I have a list from probably 15 years ago that I still use and keep because it's the only sort of a hard copy old person thing that is out there. So that might be one thing to suggest.
And then Karen?
Yeah, Lisa jumped in front of me, but that's all right. She gets to do that one time, just once, because she's my friend. I just want to reiterate what Kirby said. I know that the information is probably out there for us, but there is so much information out there for us, and there are so many links to click and so many passwords to have, and just too difficult. We almost suffer from having too much information available to us because it's just too much to go and find it all. So I would just like to reiterate what everybody's saying. You know, it's very nice. I saw yesterday that the press release came out, or maybe it was Monday, but the press release came out. We have 3 awardees in New York. We're thrilled. I definitely know of 2 of those groups. I probably wrote a letter for the 3rd because as Lisa said, I was writing letters fast and furiously this year. And I have the abstracts from a lot of them because I asked that they send them to me when they asked me to do a letter so that I can at least a couple paragraphs for what they're working on, because you know, a lot of times they just send a sample letter and I use my own letter. I don't use their sample letters. So I like to have an idea of what they're doing. But it would just be so much easier if FORHP could put together the list with the contact people so that we can just send them a quick note or make a quick phone call to reach out. And, you know, I'm not complaining. It's good that you share the press releases. It's good that the information is out in the data warehouse, but I'm here to tell you, I'm not about to go look in the data warehouse to find an abstract on a project that got funded. I can put it on my list, and it's just not going to happen in a timely manner. Not complaining, just whatever you can do to just make that information a lot easier for us. I don't know, I don't think that, you know, contact information is private for these folks. So even if you just send us their emails and their phone numbers so that we can reach out. That's all.
Thank you.
I don't see any other hands raised, Sarah.
All right, next slide. So the next couple of slides will just have a couple of FORHP updates. The first one is about the Office for the Advancement of Telehealth, which we refer to as OAT. In January, there was a Federal Register notice that announced the HHS is elevating the role of OAT to be moved from within FORHP to the agency level within HRSA. OAT had already been working to coordinate telehealth activities across the agency for the past several years. And since the pandemic, had been leading the telehealth efforts for HHS through the telehealth website, telehealth.hhs.gov, coordination and other cross-federal department efforts. This transition has been paused or had been paused, awaiting the appointment of a new administrator within OAT. Telehealth efforts across cross-urban emphasis of their programming and public efforts. Next slide. So HRSA is looking to the future of telehealth, and 2020 has shown us that telehealth provides significant benefits. Telehealth has played a key role in reducing the disruption of healthcare services. So we do know that it has improved or helped in the continuity and access to care for many. Telehealth patient populations have expanded beyond just rural areas, and telehealth has been adopted across a range of specialties, including behavioral health and primary care. So with HRSA, we believe that telehealth use will continue to grow. And HRSA's vision is to continue to work across HHS to leverage telehealth activities in order to advance the field of telehealth. We will continue to work across HHS with CMS, NIH, ARC, CDC, and ASP, and ASPR, and other departments, including the FCC and USDA, to leverage activities within telehealth. Next slide. The following slide is about community-based division within FORHP. So this slide forecasts the funding cycles of the community-based division grants. The Rural Health Network Development Planning grants are one-year grants and awarded every year. The other grants are awarded in a 4-year cycle. As SOAR, you can work with communities in need to help them figure out upcoming funding opportunities as they start preparing for them. We also send out announcements when there's a new award, as well as this information is contained in the FORHP weekly newsletter. Next slide. So over the next 2 slides, I have a couple of examples from the CBD, or the community-based division. And what is incredible about the CBD Rural Strategic Initiatives Division, which we call RSID, and the other community-focused programs is that there is so much flexibility in how the community can meet their specific needs. The programming is very community-driven, allowing communities to determine the best way to address their needs and what community partners are necessary to make the change happen. The first example in this slide is from Virginia. And this program covers a service area of 22 counties. The primary focus of this program is behavioral health, but there is a specific, the primary focus is behavioral health with a particular emphasis on mitigating the impact of the opioid crisis. Next slide. Another example within the network planning program is a project also located in Virginia, working with telehealth focus with the goal of helping rural health communities or rural health clinics connect rural patients with an addiction specialist from a treatment facility outside the region. So this is what we were talking about with increasing access using telehealth. Next slide. As a resource, we have the FORHP opioid programs TA portal. This resource is funded as part of the FORHP Rural Community Opioids Response Program, which is the RCORE. It's a great place to find information and resources for your programs, or also use it to share with your communities and stakeholders to address substance use and opioid use disorders. So it has a list of all the upcoming events, the webinars, and also toolkits that you can use to disseminate. Next slide. We have another resource, the FORHP RCORE Opioid Center of Excellence. FORHP has funded 3 centers of excellence in the fiscal year 2020 to focus on 3 different areas on opioid and other substance use disorders. So if you're interested in learning more about this, you can click on the hyperlinks on this slide, and it will take you directly to their web pages, and you'll be able to find more resources. Next slide. On this slide, we have the Rural Community Toolbox, which is an online interactive tool that provides rural relevant resources and funding opportunities to aid rural communities as they work to address substance use disorder in the opioid epidemic. This contains resources from about 17 federal departments. So you can find all this information in one place. Next slide. So on May 4th, HHS announced new funding thanks to the American Rescue Plan to combat COVID-19 across the country. Rural clinics and hospitals will receive nearly $1 billion to strengthen COVID-19 response efforts and increase vaccination in rural communities. And we've already sent information about this. And approximately $250 million will be awarded to develop and support a community-based workforce who will serve as trusted voices, sharing information about vaccines, work to increase COVID-19 vaccine confidence, and address any barriers to vaccination for individuals living in vulnerable and medically underserved communities. So we have more information on the slide about the testing and mitigation funding, as well as the vaccine confidence funding. And we've also shared a couple emails on this. And I don't know if we have any other questions. These slides will be shared together with the other slides at the end of this meeting.
All right, any questions for Sarah before we take a break?
Matt, this is Lisa. I do have a question. And Sarah, I don't know if this question is going to make any sense, but and other state offices may or may not be experiencing this, but we have had here in Pennsylvania so much information to send out to the hospitals and the clinics that it feels as if we are really, in a sense, overburdening them with information coming out, and also with the requirements of the reporting that we need to get back from them. So it's the COVID funding, which everyone is really grateful for. I don't want to make it sound as if we're not, but there's that funding, and then there's the SHIP funding, and then there's, you know, the regular flex funding and so on. And have found that we're really challenged to send information out to the hospitals and the clinics in a very organized way that is accurate, because the information, and I know you all were getting updated information regularly, but you know, the information that we would send out, you know, it would be, you know, correct as of 5 o'clock that day, and then by noon the next day it would have changed and we would need to send more information out. And we had trouble hearing back from folks sometimes at the federal office when we tried to get clarification. And so there's nothing that you really need to do to respond to it. I just wanted to say that I don't know if other states have experienced that as well, but I know our state is really struggling to make sure that we are sending clear, concise, and accurate information out in a way that the hospitals can absorb and also help them deal with all of the reporting requirements. Maybe that's just in Pennsylvania, but Karen's raising her hand.
I'm trying to do it the right way, and I can't. So I apologize.
Just go. You're fine, Karen. Just go.
My left hand up, my right hand's trying to raise my virtual hand. So here, 2 hands. I just want to say, we actually, I think that we're suffering from that as well, Lisa. It's hard to get a good read on it, but I feel like, you know, we just send these things out and they just go off into the ether because we don't hear much back. But the other thing that we have a problem with is that we have listservs in our office, you know, as most of you probably do, with all of our various groups of stakeholders to whom we send information. And if we try to keep all of that centralized, and we have a bureau mail log, which is orh@health.ny.gov, so that everything is in that mailbox, so that the whole staff can access it. And we find that too many, at least in my opinion, of our hospitals and rural health networks and our stakeholders don't open those emails because they seem they're coming from a generic mailbox when it's really coming from one of us. And they don't open things unless they're coming from either me or somebody that they specifically know within the office. And that's, I don't know how you get around that. That is really, really frustrating to me, because from an organizational perspective, we want to keep everything organized in one place so that we can all access it, and we all know what's happening. So I don't know if any of you have any tidbits to get around that, because maybe they would pay more attention to it if I was sending it, or if, you know, one of the staff members with whom they're familiar were sending it. And I just don't know how we get around that, if there's any tidbits. And that's a big fact. No, there are no tidbits, but thank you for letting me vent.
That's what regional meetings are for, Karen.
Or that's a big fat, shut up, Karen, we really want to take a break.
I mean, we're only running like 30 minutes over, so, you know.
My fault. This is the first that I've spoken in the last 15 minutes.
So even though all the announcements are included in the FORHP weekly update, for anything that would be specific or useful as a resource to SORH, I always send it in addition to it being included in the FORHP announcement. So maybe that having a staff member that they're familiar with the name send it would be useful, but that's how we've done it.
All right, thanks, Sarah. If I don't see anything else, Kirby, we'll go ahead and take a 15-minute break. Actually, a 13-minute break. We'll come back at 3:15 Eastern. Thank you for that. That was a great discussion that was.